Hi everyone, and welcome back to the Congestive Heart Failure Workshop Part 3. I'm Monica.
I'm Ivy.
And I'm Matthew.
And we're excited to be wrapping up the third part of this series with you today. So if you haven't checked out Part 1 and 2 of the series, please do so. We talked about what is congestive heart failure, how to diagnose it, what are the symptoms, and today we're excited to get more into the management and treatment of congestive heart failure. Also, throughout this video or the other videos, if you had any questions that came up, we are including a link in the description for a Google form where you can fill in questions, and then Dr. Curnew will be answering them in a live webinar on a Friday night. So stay tuned for the date of that will be coming out in the emails. Other than that, we're excited to get started in the third part.
So last time we sort of left off with different causes of shortness of breath, and we'll be continuing that today. So shortness of breath doesn't have to be caused by only congestive heart failure, and it can have many non-cardiac causes, such as COPD. So COPD, or chronic obstructive pulmonary disease, is a progressive inflammatory disease that causes obstruction of airflow in your lungs. And so a subcategory of COPD, or one of them, is emphysema. And this happens when these little air sacs in your lungs called alveoli have their walls damaged. So you can see in the image over the left, you could see the normal alveoli, and then on the right, you could see that some of the walls have been broken down. And so this causes these sacs to become enlarged, which decreases the elasticity. And so this elasticity is very important in exhaling because that is what allows you to exhale the air that you've inhaled. And so without this elasticity, it makes it very difficult to breathe out. And this causes a lot of shortness of breath because enlarged sacs also lead to less oxygen moving into your blood. And another subcategory of COPD is chronic bronchitis. So bronchitis is inflammatory. So it's inflammation in your bronchial tubes. So these are the airways in your lungs. And this inflammation causes damage to cilia and loss of cilia. And now cilia is these hair-like projections off of the walls of these bronchioles. And what they do is they help to move up mucus to allow you to cough. And so if cilia are damaged, it means it's very difficult to cough up the mucus. And this leads to more coughing. All this coughing leads to a lot of irritation and swelling. So this is sort of a positive feedback loop. And all this swelling and buildup of mucus eventually causes some difficulty breathing. Different types of lung disease, we can categorize them into two general categories, obstructive and restrictive. So obstructive lung diseases such as asthma or the emphysema that we mentioned, this is like a obstruction in your air passages, and this causes difficulty with exhalation. So it could be any inflammation or swelling that causes your airways to be blocked, and it's very hard to expel air. And so what this leads to is an increase in residual volume. So your lungs will hyperinflate because you can't get rid of all the air that you inhaled. And the other category is restrictive lung disease. So examples of this would be pulmonary fibrosis or pneumonia. And we can sort of think of this as the opposite of obstructive lung disease. This makes it very difficult to inhale, and so it just prevents the proper expansion of your lungs, and so it reduces lung capacity. And so if your lung capacity is reduced, it means you don't take in as much oxygen with each breath, which could cause shortness of breath. And this can be caused by two different categories. So this can be caused by intrinsic or extrinsic factors. And so some intrinsic factors would be stiffening, inflammation, or scarring of the actual lung tissue itself, which prevents lung expansion. And some extrinsic factors would be weakened muscles, damaged nerves, or stiffening of the chest wall, because your muscles need to expand your ribcage to breathe in, and so if those are damaged, that would lead to improper expansion. Now, a very common test you can see in the clinic, many of you might have done this already, is a spirometry test, and this tests the function of your lungs. So how this works, as we can see in the image here, you make a tight seal with your mouth around the machine, and you inhale as deeply as possible and exhale as deeply as possible, and they take your 3 best efforts. So this machine tests the volume of air that you can inhale and exhale and general lung function.
Awesome. So kind of circling back to congestive heart failure, because shortness of breath is one of those symptoms. We just wanted to emphasize that it's not necessarily indicative of congestive heart failure, but it is a symptom for other types of diseases, and that's why it's very important to communicate with your doctor and kind of go through all the processes and doing different tests, such as that spirometry test. So circling back now to medications to treat congestive heart failure. So the goals of treating heart failure are three main things: to decrease the likelihood of your disease progressing. Second, it's to lessen the symptoms, because as we talked about previously, there are several symptoms that are associated with congestive heart failure. So by decreasing the symptoms, there's a hope to improve the quality of life that you're having. So it is possible to still have a good quality of life if you are managing the disease appropriately. So we're going to kind of go through the medications, but we made a little activity out of it. So here are the common medications that are used for congestive heart failure, and we want you to kind of pause the video for a second and see if you can match the medications listed on the left-hand side of the screen to the descriptions on the right-hand side here. So take a moment to guess. Okay, so here are the answers. Spoiler alert. 6, it is a diuretic that increases the excretion of water and sodium in the urine. And there's another diuretic called spironolactone just above that, where it's a potassium-sparing diuretic that also increases the excretion of water and sodium in the urine. There's also digoxin that strengthens the force of the heart's contractions. There's also Entresto, which relaxes your blood vessels to help improve blood flow. There are ACE inhibitors that lowers your blood pressure, and it's a vasodilator as well. There's beta blockers that will slow the heart rate down to allow the heart more time to fill with blood. So these medications, depending on what the doctor prescribes, are working to help get your blood flowing and giving you all the oxygen and nutrients. Now, medications don't end there. Medicine is always doing research and progressing and finding new and improved things. Specifically for congestive heart failure, Dr. Curnew was actually running a study in his clinic that is part of a larger study. So it was 2 clinical research studies that were investigating the safety and effectiveness of another medication that's called Jardiance, or empagliflozin. And it was for chronic heart failure with preserved or reduced ejection fraction. He's still currently running the preserved one, but the reduced ejection fraction study has already been published with the results, and they're positive. So it would be interesting to hear Dr. Curnew's thoughts in the live webinar about the results of that study. But essentially, patients are randomized to either Jardiance or a placebo medication if they were eligible to be included in the study, and then they would kind of follow the patients over a specific amount of time. So in this case, approximately 3 years, to see how this medication, whether it helped or decreased their quality of life, essentially. So just for some context, if you haven't heard of empagliflozin, it's originally a medication for type 2 diabetes, but they did notice that it could help patients with congestive heart failure, and that's how the study kind of started. Medicine is always expanding, and there's so many other more studies and research that we can look into to see how we can help improve the management of heart failure.
Yeah, so now we're just going to talk about how you can manage congestive heart failure and kind of look for signs to try and catch and prevent incidences earlier. So what we're going to talk about is first what you should be doing kind of every day, and maybe if you can make it into a routine, so that way you can continue to check for these symptoms. So first, what you're going to do is you're going to weigh yourself, preferably in the morning before you eat breakfast, because that can have a big bearing on your actual weight for the day. You're going to write it down and also compare it to how your weight was yesterday to kind of see if you're an upward or downward trend in your weight. Next, you're going to also make sure that you're drinking enough water for about 6 to 8 glasses per day, and that's equal to about 1.5 to 2 liters. You'll be taking your medication according to the way your doctor prescribed. And if you have any questions, always feel free to reach out to your clinician to kind of clarify those, because we want to make sure you're taking the medication correctly. You're also going to check for swelling in your feet, ankles, legs, and stomach, and try to make sure that you're eating food that's low in salt or salt-free. So make sure that you're balancing activity and rest periods to make sure that you're giving yourself enough time and preventing those those bouts of extreme shortness of breath or fatigue. You're going to put your date, your weight, all of those lovely things that we talked about earlier, and just make sure that you're doing a general wellness check-in, so that way you're not letting any symptoms pass you by. Let's look at the different stages. So first, we're going to have the green zone, and so this is where you're having no symptoms, no shortness of breath, no chest discomfort, pain, or pressure, no swelling in your legs, ankles, legs, or stomach, and you're not gaining weight progressively. We'll see that the yellow is a cautionary zone. So this is kind of where you're going to have more progressive symptoms. So you're going to have weight gain, vomiting, shortness of breath, more so than usual. You're going to have increased swelling, cough, feel more tired, feel dizzy, these kinds of things. So the emergency stage, or the red danger zone. And here you need to seek medical attention as soon as possible if you are struggling to breathe. So that means that you're almost exasperated when you're trying to breathe. Or if you have chest pain when you're resting and when you're taking your medication, then these are some serious things that you need to get checked out. Checklist that I made, I've added this little section at the bottom right, where you can see, okay, what zone do I feel like I'm in right now? Summary slides, that way we can be as clear as possible as to what you do in each of the zones.
Okay, so along with forming good habits, as monitoring, another good habit that we should be forming is exercise. So Canadian Physical Activity Guidelines recommends at least 150 minutes of moderate to vigorous intensity per week in groups of about 10 minutes or more. And so there are a lot of benefits to exercise, some of which are like you improve your circulation, you improve your COPD symptoms, you can strengthen your cardiovascular system, and so this would reduce the development of chronic disease, along with maintaining bone and muscle health and strength. So some examples that we could include would be some brisk walking, biking, swimming, and hiking. We're going to be doing these to our own physical abilities because we don't want to overexert ourselves. And it's also recommended that we add muscle and bone strengthening activities at least 2 days per week to keep those bones and muscles healthy, because we want to be doing these exercises for the long term. Another habit to form is healthy eating. Now, healthy eating is a really good preventative measure to prevent a lot of cardiovascular diseases or the progression of a lot of these chronic diseases. And so the Canada's Food Guide, they recommend eating a lot of vegetables and fruits, at least half your plate, as we can see in this image here. Just keep in mind that fruits do contain a lot of sugars. So proteins should take up about a quarter of your plate, and we need to make sure that we're choosing proteins from foods that are coming from plants more than animals. So these could include things like tofu, lentils, chickpeas, a lot of legumes. We need to avoid processed foods that are high in sodium, fats, and cholesterol. So this includes avoiding takeout as much as possible and cooking at home whenever you can, because when you cook at home, you can ensure that what you're putting in your body is good for you. And you can also control a lot more. And so grains should take up the other quarter of your plate. And another thing that I wanted to mention is mindful eating. And so this is the idea that whenever you're eating, you should be very present in whatever you're doing. This means avoiding watching TV when you're eating, and make sure that you take in and you really experience the food and how you feel with what you eat. And so we recommend that you look at Canada's Food Guide, because this is where all this information comes from, and it's a very good resource to help you on your healthy eating journey.
So those are all important things to keep in mind in terms of managing congestive heart failure. And there's also so many great resources that you can reach out to if you need help in implementing any of these habits. So for example, we have cardiac rehabilitation programs that can help you improve your lifestyle and reduce your risk of future heart problems. So you can work with a team of nurses, physicians, dietitians, anesthesiologists to improve your health. If you check out Hamilton General Hospital, you can either call or email them and ask them about their programs, but they do offer programs to help with exercise, healthy eating, weight control, smoking cessation, stress management, and diabetes control. There's also the North Hamilton Community Health Center that offers a 10-week community-based program to help you gain control of your COPD. and they offer various resources, including group and individual education, peer support, caregiver support, and a lot of other things. So their contact is listed on the bottom left here of the slide. I guess right now, just keep in mind that with the pandemic and regulations, these programs might be altered slightly, but they are definitely resources that are still available for your use. And then finally, we also want to bring to your knowledge about the smoking treatment for Ontario patients. So Hamilton Public Health Services hosts this stop session, so to help people quit smoking. So that kind of brings us to the end of the congestive heart failure series. So just to summarize, today we talked about shortness of breath causes, including the different types of diseases that can lead to shortness of breath, in addition to maybe congestive heart failure. We talked about the different medications used for congestive heart failure. We talked about the heart failure zones and the lifestyle management and habits to form in terms of monitoring, lifestyle like eating habits and exercising, in addition to resources that you have in your community. We hope you enjoyed. Just a reminder about the link in the description for the questions, and please join us for the live webinar where Dr. Curnew will be answering more questions. So thank you.